Are the parents that you're seeing bringing their children to you? Are you proactively talking about contact lenses or myopia management with them? And what does that conversation sound like? Because when you engage parents and then their kids, you often engage, obviously, the whole family. You increase the number of annual exams, you build loyalty, and more importantly, you start addressing lifelong visual needs early. So I want you to think about what's one thing that would help you grow your pediatric contact lens and myopia management base. We'll be talking about this on the panel, and I'd love to hear what you think, and I'd love for you to be a part of that conversation, even if you're just listening after the fact. So to get most out of your contact lens practice, and then also the upcoming discussion that I'm going to have with this panel, I want you to do two things. One, I want you to pull your data. Look at your 2024 numbers. What percentage of exams included a contact lens fit or refit? And then what is your ratio of 36 to 54-year-old patients to your 0 to 18-year-old patients? I think this gives you a lot of insight. Hello and welcome to the Chris Wolfe Podcast on iCode Media. Today, I wanted to plant the seed because in just a few weeks, I'll be moderating a panel at the Vision Source Exchange this year called Unlock Enormous Potential Within Your Existing Patient Base. And we'll be recording that panel for a future episode of this podcast. But before we get into that conversation, what I wanted to do was set the stage. I want you, our listeners, to be thinking deeply and critically about your own practice. I want you to have the context so that when we have these panel discussions and we drop that episode, it actually, you've got some ability to apply that to your practice. It feels personal. It feels relevant, because it will be, because you've already had the opportunity to think about how your practice is performing. So, as always, be sure to subscribe to the podcast, write a review, share it with your friends, and support those who support us. The most common questions I get include, what ophthalmological codes or evaluation and management codes should I use? What ICD-10 codes do I need to bill with this CPT code? What CPT codes can be billed together and what can't? And my favorite, how do I manage a patient who has diabetes who comes in for a quote-unquote routine eye exam? These questions really highlight the confusion and uncertainty that serves as a daunting hurdle for providers, makes it more challenging for them to care for their patients and provide those patients with the best opportunity for a lifetime of ocular health and clear vision. That's why we built iCode Education, for this specific purpose. Our mission is to provide optometrists with resources to help you understand disease states, revenue cycles, and billing and coding so that you can put that on autopilot and truly care for your patients. Check out iCodeEducation.com. That's EYECODE education.com. We've developed a premier billing and coding bundle that includes all of our billing and coding resources in one place. We also have a 10% discount code just for listeners of this podcast. Enter the coupon code EYECODEMEDIA22 at checkout. We'd love to work with you. Check out iCodeEducation.com. Hello, dedicated optometrists. Are you looking for a way to support your patient's vision and overall eye health? Let me introduce you to Vision Edge Pro, a visual performance supplement that stands out in our profession. Vision Edge Pro contains a balanced blend of mesozeaxanthine, lutein, and zeaxanthine in a 10-10-2 ratio. This combination has been scientifically shown to increase macular pigment density, which enhances visual performance, including contrast sensitivity and vision in glare situations. Additionally, Vision Edge Pro provides 300 milligrams of DHA and EPA, fulfilling the daily requirements for omega-3s as recognized by the leading health organizations. This ensures your patients receive the essential nutrients their eyes need for optimal health. Whether it's for everyday screen use, night driving, or enjoying the outdoors, Vision Edge Pro supports your patients in seeing their best. Recommend Vision Edge Pro for your patients today and help them achieve clearer, healthier vision. Contact your local MacuHealth representative for more details. Vision Edge Pro, because your patients deserve the best in eye health. Go to MacuHealth.com and use the coupon code PODCAST2024 at checkout for special discounts. So let me start by asking you something simple. What's the percentage of your comprehensive exams, and make it 2024, that's easy, that included a contact lens fit? And what I would say is a fit or refit, however you're going to track that data, I want you to think about it. That might be you use one code for all contact lens fits. You might use separate codes for multifocal or toric or myopia management, whatever it is. I would kind of add that all together, and then I would divide it by the number of refractions. So that gives you a percentage. Then you can even get more granular, because you could then look at each one of those individual fits, toric, multifocal, soft contact lens, as an example, and then see how that relates to your total contact lens fits. If you don't know, you're not alone. If you don't know those answers, you're not alone. And we will ask our panelists to pull that exact number from the EHR, because we often feel what we're doing doesn't really match what the data says we're doing. And we feel like we're fitting a ton of contact lenses, but the actual number is sometimes humbling in my experience when we really dig into this for practices. And here's why it matters. There's a huge opportunity to better serve our patients and build our practices just by being more intentional with what we're already doing. Another topic we're going to dive into during this panel is how do we attract new or lapsed contact lens wearing patients who are either unaware, skeptical, or just haven't been asked in a while. It starts obviously with that awareness from the front desk to the exam lane, where we're consistently presenting contact lenses as an option. Is that from the doctor? Is it the technician? Are we explaining why behind that recommendation, or we're just assuming the patient will ask if they want them? And if the patient had a bad experience years ago, are we making the effort to reintroduce them in what is possible today? So a quick gut check for me, and one of the things that you can think about is, what's the biggest barrier stopping you from fitting more contact lenses? Jot it down, think about it. Because when we record with the panel, we're going to share what other doctors are saying, and maybe your challenge is more common than you think. We're also going to be discussing patient loyalty and how simple systems like annual supplies and in-office inventory and branded contact lenses can help build stickiness within our own patient population.
CooperVision and the AOA have joined forces in a groundbreaking initiative to transform how optometrists treat children with myopia. The Myopia Collective aims to unite our profession and its allies to challenge the status quo and elevate the standard of care for children with myopia. Everyone is invited to become a member of the collective. By joining, you pledge to act in slowing childhood myopia progression. Membership includes regular updates and information about the collective's efforts, access to educational opportunities and resources, and insights from the ambassador optometrists who advocate for community policy and changes supporting the collective's mission. Click the link in the show notes to join the collective today.
We're also going to go deeper. So how do we introduce new contact lens technology to our practices? Are we being intentional? Are we using innovations as a way to build trust, or just something cool to mention? One of the panelists will probably mention things that will assess or evaluate technology, but technology alone doesn't retain patience. Conversations does. Or conversations do. And so another part of that discussion that I'm excited about is the opportunity for children. So we're going to challenge each other with the panelists, and hopefully this will challenge you with the ratio of kids to adults in your practice. Are the parents that you're seeing bringing their children to you? Are you proactively talking about contact lenses or myopia management with them? And what does that conversation sound like? Because when you engage parents and then their kids, you often engage, obviously, the whole family. You increase the number of annual exams, you build loyalty, and more importantly, you start addressing lifelong visual needs early. So I want you to think about, what's one thing that would help you grow your pediatric contact lens and myopia management base? We'll be talking about this on the panel, and I'd love to hear what you think, and I'd love for you to be a part of that conversation, even if you're just listening after the fact. So to get most out of your contact lens practice, and then also the upcoming discussion that I'm going to have with this panel, I want you to do two things. One, I want you to pull your data. Look at your 2024 numbers. What percentage of exams included a contact lens fit or refit? And then what is your ratio of 36 to 54-year-old patients to your 0 to 18 4-year-old patients. I think this gives you a lot of insight. We're going to dive into that more on why that's important, but you'll see why it becomes more critical as time goes on. Then reflect on those questions. I want you to listen to them. I want you to think about them, and then think about what opportunities am I missing with existing patients? Where are the gaps in awareness, retention, and communication or follow-up with patients? So here's the exciting part. The Vision Source Exchange panel will be recorded, and that conversation is going to come to this podcast feed. If you can't be there in person, you won't miss a thing. But if you're going to be at the event, come ready, bring your numbers. We will have some polling software that we will be able to participate with. Bring those insights and your curiosity. And when we're honest about those gaps, we can be excited about the potential growth. You don't have to overhaul your entire practice to grow it. You just have to become more aware and more intentional with the patients you already have. And that's what this panel is about. That's what this podcast is about. So I hope this was helpful, and I will see you on the next one.